We are running a program called Jijue. So basically, Jijue promotes the mental wellness of adolescents, girls, and young women, including people living with disability. The project targets between the ages of 15 to 25 years old age, both in and out of school. And through this targeted project, we ensure that we promote mental wellness, we create awareness on issues around mental health, and also provide referral. So we have been doing refresher training for our TOTs, so that as we start the year with where we are going to form mental wellness clubs in the schools, we are able to now have kind of refreshed memories in terms of people who understand what mental wellness is all about, what it means to provide psychological support, and also provide referral.
My name is Cosmas Ingisa. I'm a trainer in matters of mental health and psychiatry. So I'm humbled to be in this organization, COME Initiative, which I got an official invitation to do capacity building in terms of training and TOT training, in which we identified areas of concern, since the organization is doing very good work in terms of mental health in schools, and also they do a mentorship in terms of adolescent.
First of all, I would like to talk about mental health, which basically means it's a state that enables one to understand his or her capability to know how to deal with stress, daily stress. And mental illness is a condition that distracts one's emotion or mood.
Mental health TOT training has been a quite wonderful journey, learning through several topics, and what stood out for me is on adolescent mental health. Working with the COME Initiative through Jijue project, which majorly aims at promoting mental wellness amongst adolescent girls in schools and out of schools, this topic was quite of an interest, because looking at the adolescent stage, we tend to assume on their mental health. In most cases, we assume that the behavior changes they have are in relations to their development issues.
I've been able to get the privilege to go through training of trainers mental health. This has deepened my understanding on mental health, what mental health really means, why it matters, and how we can respond as individuals and communities, and also how it affects different groups of individuals in the society.
I've learned the different types of disorders, and what I've learned most among the disorders, there is one which affects teenage girls and boys, and most of the people, the caregivers, they don't know if that's a form of mental health. They just think that the child is rude or is having misconduct, not knowing that it's a form of mental health. And through that, I'll be able to share more knowledge and create awareness to the caregivers on how to deal with such kind of mental health issues, so that they can keep the children in line and offering positive discipline to the girls and boys.
I have had a very informative and eye-opening experience about mental health. I have had a deeper knowledge on mental health, mental wellness, and different types of mental diseases that I'm now able to identify. There are so many causes of mental illness that caregivers like parents should know about them and should know how to handle them.
The training covered major areas of concern. Number one is about awareness of mental health, facility, and also in schools. We also looked about the common mental conditions, which are more, especially in schools, adolescents, and also young age.
Our key spotlight was on adolescent mental health, and we've been able to understand the unique challenges and issues that affect adolescents in schools, and the need for us as stakeholders to come up with early interventions.
Having been trained as a TOT on mental health, I plan to use this knowledge to create awareness on adolescent mental health. Adolescent mental health is one of the key aspects that we have identified that in this development stage, there are quite at a high risk of developing these mental health disorders?
Going to school, I'll ensure that every school that we go to, they have a teacher in charge who is taking care of mental health issues, because most of the kids, they spend too much time in schools, and that's where they have problems. And we'll also see how to help them, working with other stakeholders in the community like health practitioners, local authorities, parents and teachers.
One should be able to know that mental health is as important as physical health, and no one should also be left to suffer in silence. Najijua.